perfect system. One of the biggest things that happens as you age, especially over the age of 85, and 65, and then really over 85, is that you lose the ability to make intrinsic factor. If you lose the ability to make intrinsic factor, you can't take in B12. If you can't take in B12, you start this cascade of escalating disease to the point that at some point it can't be reversed. So once you see patients over a certain age, I don't know whether the screening starts at 50 or 60, they start screening for B12 levels because you have to catch it early enough before you get irreversible neurologic damage. So evolutionarily speaking, this system has some flaws. So let's talk about what can get in the way of getting. Okay, so let's talk about gastric damage. So Helicobacter pylori, this came, when I first started studying this stuff, all ulcers were caused by stress. They were sure that it was caused by stress or maybe too much coffee. H. pylori is now the prevalent cause of stomach ulcers. So if you get a patient who's been infected with Helicobacter pylori and you get stomach damage, you're not getting all of these different processes happening. You're not making the R-binding protein. You're not making the intrinsic factor. You can't get the B12 in, okay? Atrophic gastritis, which is a lot of times associated with aging. So what that means is atrophy, cell atrophy is sort of cell death. You're not replenishing, right? If you have hyperplasia and hypertrophy, you're growing cells. Hypertrophy is growing each individual cell bigger. Hyperplasia is growing more cells. So if you have gastric, atrophic gastritis, your cells are shrinking. Your cells are shrinking, they're not doing their job. If they're not doing their job, you can't get this in because they've got to do all that work, right? Okay, so what else might you have? You've got to look at your diet. Your vegan diet. What else can happen? So those are the two big ones that I can think of, but it's really important to understand how gastric damage relates to this, because that's one that you're going to see often as you go out into the nutrition world, B12, okay? All right, so let's go back to the, I'll take my picture.